This is the All About Vision series from the Early Years Project. Vision testing. We use QR codes to direct you to different resources within our videos. In order to use a QR code in a video, pause it when the QR code appears. And then on a different device, open your camera and point it at the QR code like you're taking a picture. A link will pop up, either tap or hold it to access the resource. If that doesn't work, you can try holding your device steady or get closer to the screen. If you want or need to access a QR code from a screenshot, take a screenshot when the QR code appears in the video, and then later on you can open the device's photos and tap or hold the QR code to be brought to the link. These machines are typically located in a semi-private area in an eye doctor's office, and the tests with these machines are usually completed with a technician. They may look big or high-tech, but they're completely safe and painless. Each one gives the eye doctor important information to help catch vision problems early and keep your child's eyes healthy. This is a typical setup of a room where a patient would see the eye doctor. Vision screening versus exams. So, vision screenings are a helpful first step, but they are not a full eye exam. Think of a vision screening like a quiz in school. It's a quick set of questions to see if you know the basics, but it's not too detailed and it does give you an idea of how you're doing. A full eye exam is more like that big test. It's more thorough and it checks everything, making sure you understand all the material and you don't miss anything important. A screening only checks for one or two specific eye issues and are meant to show if more tests are needed or not. The name vision screening can be misleading. It sounds like a full checkup, but it isn't. For example, we don't say like cancer screening, we say breast cancer or skin cancer screening to be more specific. And some people argue the same should go for vision. So most screenings actually do not check how well the eyes focus, how well they work together, color vision, and these are some of the most common vision problems in young children, and they need a full eye exam by an eye care professional to detect them. Many people assume that if a child passes a vision screening, their eyes are healthy, but research shows this often is not the case. In fact, 73 out of 100 children who pass a routine screening, such as that big E-chart, may still fail a comprehensive eye exam. Another study found that the vision screening missed over 75% of children with farsightedness or problems with eye coordination and tracking. Screenings, while helpful, are limited. They are designed to flag concerns, but they are not designed to diagnose them. An eye exam is more formally known as a comprehensive eye exam, and it is made up of many smaller tests that each check something different about your child's eyes. And there are 9 common types of vision tests: the visual acuity test, refraction test, binocular vision test, visual field test, pupil response test, eye movement or ocular motility test, depth perception test, color vision test, and the eye health exam. And most of these are pretty common for children to complete. So all of them except for the visual field test, really. Making the eye exam a positive experience. Between the ages 3 and 5, children should have a comprehensive eye exam done by an optometrist to make sure that their vision is developing properly and to check for any signs of eye disease. Early detection is key to supporting learning development and confidence. Here are some tips, again, to make the eye exam a positive experience. Schedule the appointment early in the day when your child is well rested and alert. Arrive early to leave anything that could be an additional stressor behind. Make sure to have enough time for paperwork and maybe showing your child around the waiting room. Talk to your child ahead of time about what to expect. Keep it simple and reassuring. Maybe even act it out ahead of time. Describe the equipment in kid-friendly ways, like saying the eye chart is like a big puzzle, or the eye doctor will use a special flashlight to look at your superhero eyes. Allowing them to bring a comfort item, having a special toy there can make all of the difference, especially if it has a face. The eye doctor can do an eye test on a teddy bear first to show the child that it's safe, and then they can do it on your child. And a reward system. Listen, I am not above bribery in my own children, and every once in a while, bribing them to do something that is good for them is totally fine. So, if they are able to sit through a whole eye exam or a treat, a trip to a library, or going to the park, whatever, it's totally worth it. And a fun, relaxed approach can help your child feel comfortable and even excited for their eye check. So next we're going to go through the different types of tests and kind of describe what they are. So the visual acuity test, what it does is it checks how clearly a child sees things far away or up close. And it generally looks like a child reading letters or shapes or pictures from a chart, similar to that big E chart that's in this picture here. Refraction test. So what this does is it finds out if your child needs glasses, and if so, what kind. And it can look like this here in the picture. The child will look through a machine while the doctor switches the lenses, asking questions like which one is better, one or two, A or B. And it goes on like that for a while. And sometimes your child can be unsure. It's okay, just give them positive feedback and let them know that's totally normal and they can take their time to make the decision if they need to. The eye movement or ocular motility test. So what this does is it checks how well the eyes move and work together. So what it's like is your child will follow a light or a toy or maybe even the doctor's finger with their eyes without moving their head. So this picture here kind of shows the typical patterns that the doctor will do. The binocular vision test. So what this is it makes sure that both eyes work together to focus. So there are a couple of different tests to do that. One here, like you see this girl doing, is participating in the cover uncover test. And it could also be one that looks like your child wearing special glasses to look at pictures or patterns that would appear in 3D on a special device that the doctor is holding. The color vision test. So this checks to see if your child can tell colors apart. And it looks like the pictures here on the screen. The child will look at the pictures made up of the colored dots and try to spot the shapes or the numbers inside of the circles. The depth perception test. So this checks to see how well your child sees distance and space. So what it looks like is typically using these devices here, and your child may be asked to look at these 3D images with those special glasses, or maybe they're asked to grab objects that seem closer or further away. Pupil response and eye health check. What this does is it checks if the eyes respond normally to light and if the inside of the eye is healthy. So typically it looks like a light being gently shined inside of the eyes, and sometimes they'll use drops just to see the inside of the eye better. Eye exams for babies and toddlers. A quick note on eye exams for babies and toddlers. The tests may look different for those younger ones, and sometimes they're not able to do some of the more complicated ones. And so these here are just some pictures that show a little bit of that difference. So this QR code, sorry, will take you to a video that walks you through an eye exam on a baby, and it's not working here. But what I noticed in watching the different videos on babies getting eye exams is really the doctor's ability to engage and interact with that baby on their level and then adapt to the baby's mood. They can actually get quite a bit of information. One of the most important things for families to know after a child is diagnosed with vision differences is that you are not alone. In Illinois, we have support through the Illinois Early Learning Project, the Illinois Service Resource Center, ISRC, and the Illinois School for the Visually Impaired, and many more. Some additional resources we have listed for the Early Years Project, and they can be accessed through this QR code. Remember, passing a vision screening doesn't mean your child's eyesight is perfect or will stay the same forever. It just means no problems were found at that time. If you have concerns about your child's development, consider reaching out to your pediatrician, optometrist, early intervention specialist, or a developmental pediatrician for support and guidance. Even if your child passes that screening, it doesn't mean that an issue will never come up. The Early Years Project is brought to you by Illinois Hands and Voices Guide by Your Side and Illinois Early Hearing Detection and Intervention Program, or EDI. Please take a moment to take our brief survey. Thank you so much for watching.